A Texas physician is heading to federal prison for 10 years. That's the sentence a federal court handed down over $118 million in fraudulent healthcare claims, according to the Department of Justice. Prosecutors say the doctor knowingly issued false diagnoses to patients, not to treat them, but to justify billing insurers and government health programs for treatments and procedures that weren't medically necessary. 10 years. $118 million. Those are the two numbers at the center of this case. And by the end of this video, you'll understand what the Justice Department says happened, how a scheme built on paperwork and diagnosis codes grows into a 9-figure fraud, and where this case stands right now. Here's the question this case raises. How does a single doctor, someone patients trust with their bodies and their medical records, end up accused of manufacturing the diagnoses that unlocked a $100 million billing pipeline? What does the public record actually say about how that happened, and what doesn't have a clear public answer yet? We're going to walk through this the way the Justice Department laid it out, fact by fact, without filling in blanks we can't source. According to the Department of Justice, the core of the scheme was deception at the point of diagnosis. Prosecutors say the doctor knowingly issued false diagnoses to patients. A diagnosis is the trigger. It's the piece of paperwork that determines what an insurer or a government health program will pay for. Once a diagnosis is on the chart, it can justify a cascade of billing for treatments tied to that diagnosis. Prosecutors allege the treatments and procedures billed here were not medically necessary. The diagnoses weren't made to guide patient care. According to the government, they were made to unlock payment. The dollar figure the Justice Department attached to this is $118 million in fraudulent healthcare claims. That number didn't come from one bad month of billing. A figure that size, in federal healthcare fraud cases, usually reflects claims submitted over an extended period across many patients, run through the ordinary channels of insurance and government billing, so that each individual claim looks unremarkable. It's the pattern across thousands of claims, not any single one, that investigators use to build a case like this. The outcome the Justice Department announced is a sentence of 10 years in federal prison. A sentence that length in a healthcare fraud case signals that a federal court found the scope and intent behind the conduct serious, not incidental. Federal sentencing in fraud cases is shaped heavily by the dollar amount attributed to the offense, and a loss figure in the tens of millions, let alone over $100 million, pushes a case toward the upper end of federal sentencing guidelines. We won't guess at courtroom details we don't have on the record. What we can say, based on the Justice Department's own announcement, is the outcome itself. 10 years, tied directly to a scheme built on false diagnoses and $118 million in fraudulent claims. As general context, separate from any claim about this specific defendant's motives, this case shows how much financial weight a single field on a claim form carries in the American healthcare payment system. That's exactly why federal healthcare fraud enforcement increasingly relies on data analytics rather than waiting for a patient complaint to trigger an investigation. Now, for some background, separate from anything specific to this case, healthcare fraud prosecutions like this one typically move through a specific federal pipeline. Investigators, often working with the Department of Health and Human Services Office of Inspector General, a state Medicaid fraud control unit, or the FBI, start by looking at billing data. Healthcare claims in the United States are electronic and heavily coded. Every diagnosis and every procedure has a corresponding code, and those codes are what insurers and programs like Medicare and Medicaid use to decide what to pay. That system makes fraud detectable at scale. A provider whose billing looks statistically different from peers doing similar work tends to surface in data analysis before anyone opens a physical file. Once a pattern is flagged, investigators compare the billing codes against actual medical records to see whether the diagnoses on paper match a patient's real condition and treatment history. When prosecutors allege diagnoses were fabricated, that comparison, chart against code against outcome, is usually where the case gets built. None of this describes what specifically happened in this Texas case beyond what the Justice Department has stated. It's simply how this category of federal case generally comes together. Let's be precise about where this stands. The Department of Justice has announced a sentencing outcome, 10 years in federal prison, and has publicly stated its account of the underlying conduct. Knowingly false diagnoses used to justify billing for care that wasn't medically necessary, totaling $118 million in fraudulent claims. That's the government's stated position, and a sentence has been handed down. Where a case has resulted in sentencing, the conviction or plea underlying it is a matter of public record. Details beyond what's been made public, including the physician's identity, the specific court, the exact sentencing date, and the full factual record presented at trial or in a plea agreement, aren't part of the summary we're working from here, and we won't invent them to fill space. Here's what we genuinely don't know from what's in front of us. We don't have the doctor's name, the federal district where this was prosecuted, or the exact date the sentence was handed down. We don't know whether this came from a guilty plea or a trial verdict, how the scheme was originally detected, whether other individuals or a clinic and its staff were also charged, or whether restitution or additional penalties came alongside the prison sentence. We also don't know which specific insurers or government programs were billed or over what span of time. Rather than guess, the honest answer is that those details need checking against primary sources directly. Worth noting too, federal healthcare fraud cases like this one can carry consequences beyond a prison sentence. Courts often order restitution meant to repay the defrauded programs, and providers convicted of healthcare fraud are typically excluded from billing Medicare and Medicaid going forward, a separate administrative action handled by Health and Human Services rather than the sentencing court. Whether restitution or an exclusion order was part of this particular outcome isn't stated in what we have to work from, so we're not asserting it here as fact about this case. If you want to verify this story or dig deeper than we can here, the most reliable places to look are the Department of Justice's official press release archive, the FBI's National Press Release page for healthcare fraud cases, and the Health and Human Services Office of Inspector General's Enforcement Actions database. All are searchable by keyword, by state, and often by defendant name once you have it. Federal court records for the relevant district are also public and searchable through PACER. That's what the record shows and what it doesn't as of today. A 10-year federal sentence, $118 million in claims the government says were built on false diagnoses, and a case whose full detail is still, as far as this summary goes, locked mostly inside the court file. We'll keep watching this space for whatever the Justice Department releases next.